Bluegrass.
President Trump's budget reconciliation bill, aka the One Big Beautiful Bill Act, is now law. Throughout the process, we hear concerns from several different interest groups about the impact of proposed cuts, particularly in the medical community, and the risk of closure for 35 of Kentucky's rural hospitals. Those cuts are no longer just proposals anymore. A joint letter to Congress from the Kentucky Hospital Association went in detail over why they believe that some services will need to be dialed back or ended entirely under the final version of the bill, saying by capping Medicaid state-directed payments, it would reduce that pot of funding by a projected 90%. Governor Andy Beshear has made several appearances on national television over the past week, sounding a warning.
The way they find those 35 hospitals is how much funding do they get from Medicaid as opposed to other sources. Now, if you lose 10% of all of your Medicaid funding and you're 40 to 60%, Medicaid, and your patients coming in, then you can't afford to keep certain lines open. And what hospitals are already talking about right now, I talked to one the other day that was saying they might lose 200 employees.
The KHA says they did support the original House version of the bill, and it's also important to note that the sunsetting of these payments will not begin until 2028. So, Representative Gordon, I want to start with you here, at least give you an opportunity to respond to some of the governor's comments there, but also throw the question at you. A lot of the argument has been that this is what people voted for. Is that a fair argument?
Well, again, we have kind of been the theme of making the most of what you have during this show, whether it's been in education or with the SNAP benefits and now certainly with the hospitals. It is not the goal for any hospital to close or any person to not have access to health care. But again, we need to be sure that we're delivering it in the most effective and efficient manner.
Representative Brown, what are your concerns on this?
I think that it's clear that this is not a big, beautiful bill. It is a big, ugly bill. And it depends on the ramifications of what comes from the bill. And I think that it's ingenuous for this bill to hold off implementation that has been passed with this bill until after the midterms.
So
and I think it's intentional, absolutely.
Do you think that delay will be enough time to at least address any unintended consequences?
Possibly, if they're unintended. I think that the consequences are intended, clearly intended. They're looking to do what they're looking to do. The president said when he was running for president in '24 that there will be no cuts to Medicare, Medicaid, or any of those programs, or Social Security. No cuts. But here we are, that we have cuts in this big, ugly bill.
You want to respond to that?
I certainly do, because this General Assembly had the forethought. We knew these cuts were coming, and that's why the Medicaid Oversight Advisory Board was established. And it's not just legislators that are on this committee. The health plans have a seat at the table. Users of the system have a seat at the table. Other people that have input that can make this program more robust. Look, we don't want anyone kicked off of Medicaid that doesn't need to have it. This program was intended for children, mothers, disabled. Those resources will be there, and it will be very robust. What we don't want on this program are people that are able-bodied that could be working and contributing. When people come off Medicaid, it's our hope that they don't go to nothing. We hope that they will go to a private insurance, and so I'm sure hospitals would much rather see someone with a private insurance plan as far as the reimbursement.
This is a point I've heard come up a lot during this debate as well, which is relying on Medicaid to keep a hospital open, is that a flawed business model, to y'all's thinking?
Absolutely. There are ways to make the Medicaid system more cost efficient. For example, I passed a bill in 2022 that would have allowed people that need assisted living to be able to have that provided by Medicaid. Right now, the only choice is to go into a skilled nursing home. A lot of people don't need that level of care. This would have saved hundreds of millions of dollars. The General Assembly passed this bill, and Governor vetoed it, unfortunately. So there are ways that this program can be more effective and delivered in a manner so those that truly need the system will have the resources and the help that they need.
What are your thoughts, Representative Brown?
We're having a serious problem in my district in the north end of Lexington with assisted living, and we're having people that are funding assisted living facilities, and they're not letting people in the neighborhood know that that a property is being discussed for putting people into those properties. So there's a big uproar, and it's happening with the Lexington Fayette Urban County government. There will be a piece of legislation coming up when they come back in session discussing sober living houses, and people in my community have a problem with those sober living houses going into districts and neighborhoods where they're not getting input, or they're not being notified that those properties are being put in there, and they're using Medicaid dollars to a large degree. So there is some abuse, I think, with sober living houses.
Yeah, I imagine there'll be a lot more discussion about that as we go into 2026. Thank you both for your insight. We'll be right back.